The Department of Health and Human Services is recommending fewer vaccines for kids. Federal health officials say shots like the flu and RSV vaccine are optional for families, although certain ones will still be recommended. Our health expert, Dr. Kohli, is here. Why did this happen? Are there any scientific findings that back this up?
So I want to be very clear about this. There is no new science to make this change. What the HHS did is what's called a comparative science study, where they said, okay, let's look at 20 other countries and compare ourselves to what other developed countries are doing. And they found that the US tends to vaccinate more childhood vaccines than other countries. And they specifically compared to Denmark, which only does 10, and we do 18. So they said, okay, we're going to pare it back.
But those two countries are so different.
Right. Apples and oranges. You're talking about a very flawed science because Denmark is a very different place from the US. They have a centralized healthcare system. They don't have nearly as many people going in and out. They have a much smaller population. And if people get sick, there's an infrastructure socially to get them treated. And on top of that, they have different prevalence of diseases. So it's sort of like saying, well, the kid down the street does this or the house down the street does this, so I'm going to start doing it. So to me, it really boggles my mind that this is what they're using to change things. When Denmark is not the gold standard, there's plenty of other countries that are very similar to the US that do vaccinate 16, 17, or 18 vaccines. And we have no evidence whatsoever, scientific evidence, to say that what we've been doing is harmful.
And it's confusing, just as a parent, right? I typically will listen to the CDC, and it's usually in alignment with my children's pediatrician. That no longer exists. So first and foremost, for the viewers out there, what exactly has changed with the vaccine recommendations?
Okay, so there's 3 categories now. So the first is mandatory. So that used to be 18, now it's down to 11. Now that includes measles, mumps, rubella, polio, chickenpox, HPV. So thankfully, those vaccines are protected, will still be covered by insurance, and they're still in alignment with what we were doing before. But what they've done with the remaining 7 vaccines, which include things like meningitis, hepatitis A, hepatitis B, RSV, flu, COVID, is to make it entirely optional. So there they say you could, if you're high risk, you should probably get it, but otherwise just have a shared clinical decision making. And you're talking about hepatitis A, which got reduced in incidence by 90% with the vaccines. You're talking about making the flu vaccine, the COVID vaccine optional, and meningitis as well for our young kids. So I really worry because, as you said, Sam, the American Academy of Pediatrics still saying get all those vaccines. Now the CDC saying don't get those vaccines. And back in 2023, even when the CDC was saying everybody should get COVID, every child should get COVID, only 10% of kids were actually getting it. So now that you've thrown in this more confusion, parents are going to wonder, is it because it's not safe? Is it because it's harmful?
Question it,
right?
Which means lower vaccination rates.
And yet, I mean, there are lots of kids that die in college of meningitis. That's one of the things I hear about. And then RSV vaccine didn't exist when I gave birth, and I had a January baby. That's the first lecture they give you. I remember our morning anchor here, Kyle Dyer, her second daughter was hospitalized for a long time, born in January, RSV.
So what you're saying, Kim, is that changing this vaccine schedule, and this is exactly what's going to happen, is going to lead to more pediatric illness, more hospitalizations, and almost certainly more deaths. And you're talking not just about the people that have the choice whether to get vaccinated or not, but even the ones that don't have the choice now getting sicker, because there are plenty of kids out there whose parents can't either afford the vaccines, they don't have access to care, or for medical reasons they can't get the vaccine. And so if the entire background rate of infection goes up, even the people that are vaccinated are actually going to get sicker. So I'm really concerned that this is going to start a trend of more kids in the hospital, especially RSV makes little babies very sick
so awful.
and can even die.
And they're helpless. And
terrifying.
Yeah, and they count on us to make these decisions to keep them safe, right? So where do we go from here, Dr. Kohli? There's a lot of disinformation, a lot of public distrust. What would you recommend to parents right now?
You know, I would say that every single parent has to talk to their pediatrician before making any decisions and trust in the vaccines, because the vaccines have really served us well. Now, one of the things the report said that the HHS put out is that we need randomized controlled trials. I'm not sure any parent would randomize their child
No.
to not getting a vaccine,
Right.
right? Because it's unethical. I'm not sure that we could do that study ever. So we really have to rely on historical data, knowing that vaccines are one of the greatest, literally, accomplishments in medicine, and backtracking on that is a bad idea. So when you're not sure, talk to your pediatrician, but don't be afraid of those vaccines. There's no new science to suggest any harm. There's plenty of science to suggest benefit.
Thank you. That's scary stuff.
Yes. Dr. Kohli, appreciate you as always. And you can find more with Dr. Kohli at 9news.com/Dr. Kohli.